Well, it finally hit home that it was here. My first patient actually had come in with a completely different complaint, and then we just so happened to do lab work, and they were IgG and IgM positive.
I guess the real seminal moment for me was, and I'll never forget it, it was in March, mid-March, and we were sitting at our boardroom table, and I was sitting next to Mary Tarver, our emergency preparedness, and we were in we were doing a pandemic preparation meeting, and she leaned over to me in the middle of the meeting and said, "They just confirmed a case in Cabrini. This is the first one in Central Louisiana." And I knew from that point on it was going to be different. One of the things that I would say has impressed me is that those core values and that mission statement being on everybody's heart was here pre-pandemic, and the best testimony I can tell you is it never changed. We woke up the next day and said, well, this is still our mission, these are still our values, and regardless of what's happening, we've still got to serve the patients.
I think one of the most difficult parts of preparing for the coronavirus and for the pandemic was that everybody was relying on us to have a plan. When I look back on everything that we did, it started with our administrative staff and all department leaders. You have to set the tone for staff. If you're upset, you're nervous, you're concerned, then it just plays out with all the staff. So everybody really, we went and made rounds on all the departments. We're bringing them the information directly from the CDC. We're telling them that this is what we know today, and it's going to protect you, and you're going to be able to take care of the patients.
This pandemic has really recognized laboratory staff, and it has identified how much or how important the laboratory is. This COVID pandemic affected every single person in our laboratory, every department. There is a test in every section of the laboratory that was related to COVID. We were short-staffed, but they still came together, and just kind of really battled.
On March 19th, we had our first case here at the hospital, and that's when we really realized it was here and that things were going to be different.
The proudest accomplishment is that from the beginning, we have had the PPE that we needed to protect our associates. People reaching out to us from other businesses, asking for help or guidance or questions, and just trying to see, what do we do, how do we do this?
We have a community benefit program here at the hospital, and it allowed me to work with our school to get the guidelines in place so we can get our kids back to school and keep them in person.
It was all why is this happening? Relearning and understanding what we were going through played this huge role in our education of what we're going to do and how we're going to go from there. Every day, because this is new and different and it's something that nobody has ever experienced before, we don't let it get us down, and we just keep going. We're very fortunate though. We have such a tight-knit group and a tight-knit hospital. We all grieve in our own way. We grieve for our patients, we grieve for their families, we grieve for our own.
I felt protected in a sense because I'm human and they're human. And of course we are nervous, but we take our precautions like we need to. But in the same sense, you still want to show that compassion, because regardless of what they got going on or what we have going on, we're still here to be for one another. And that's most important for me. We're here as a team to keep and make people safe.
You kind of take it one day at a time. You still portray the advocacy for the associates. You just listen and try to find out answers to their questions. You try to calm their fears in the midst of maybe your own. It still all rolls back up into being an advocate and helping them do their job better. We like to say that our role is that we take care of those who take care of the patients. And it was really a team effort, no matter what your role was.
March the 11th will mark a 1-year anniversary for the last time I was able to hold my daughter, hug her, tell her I love her, and at the time she had this bronchitis type cough that she normally gets every year when the pollen starts falling. Next thing I know, about a week later, she calls me, she's got fever. She has the symptoms that are related to COVID, and I said, go to the emergency room and get tested. So she went, and they sent her home, said she was negative. A couple of days later, she called and said, I'm not doing any better, I'm feeling worse, and I can't hardly breathe. I said, well, go back. Of all the things, it was the hardest was not being at the side of my daughter when she needed me most. The last time I talked to her on the phone, she was holding her cell phone out to the side, and she said, Daddy, I don't think I'm getting better. And her nurse came down and we talked, and she said, she's really deteriorating. I think we need to move her to the unit. And she never came off the ventilator. She died April 2nd. It's tough, but I'm not alone in this world. I mean, look how many thousands of people have died. And I try to think of how can I help instead of hurt. As you come to the hospital, as you get into that emergency room, when they're in our department, they're family, and we're going to take care of family.
The challenge is the unknown, and it was everywhere. It's not unique to here or anywhere, probably across the world. The biggest thing is the unknown. We were extremely aggressive in our therapies, and then as more knowledge and more exposure to disease came out, we actually found to a certain extent less is actually more with a lot of patients. The coronavirus is individualized. It doesn't necessarily follow a set pattern per se. Everybody responds just a wee bit different. I think you have to be upfront, explain them the situation we're in, and then accommodate your workload to make it work. The focus is on doing the best you can do every day. Do the best you can do for your patients today, and then we'll do better tomorrow.
With COVID, I was kind of like the point person, looking at keeping the doctors informed of the treatment options, working with the associates on the proper use of PPE, working with the lab on the lab testing, trying to coordinate when we're running low on items, how are we going to get through this time period while we're waiting to get more. And then there's a lot of education of the staff in general. And it was just trying to pour through the medical literature to try and learn as much as we could to be making the best informed decisions. The monoclonal antibodies, I think it goes to show the teamwork and the collaborativeness of everyone. We knew this was an important treatment option that we wanted to offer. Here we are in a nursing shortage, and you need a nurse to be infusing this treatment. And in the region, there was really no other source. There were people who had driven from Shreveport over 2 hours to get it because there was very limited supply, and we were trying not to turn anyone away.
We have infused patients from all walks of life since November 19th. And so they know that coming in there, they're there to get treated for that, and that exemplifies our mission statement. That it doesn't matter if they're the head of a big church or the CEO or they're from a shelter. They know that they're there to see Billy, and our team is going to work to get their treatment done on an outpatient basis and get them recovered.
Healthcare as a whole is a passion of mine, and I think it should be available to all. When you look at communities that don't have the resources that we have, because we live it every day, we understand it. If not, we can go to someone and get information. That's not necessarily the case when you get into those areas that's most vulnerable. So what you have to do is rethink, how do I get it to them? And what we decided is that you need to take it to those communities. And so if you go to those communities, push the information out there, go through the base, the faith-based organizations that are there, or any of the nonprofits, and communicate, then you probably can reach those who would no longer, would in most cases not be able to be reached.
Everything was changing. This was something that we had never faced before. So we were always constantly learning. There was new evidence coming up, new research being done. So it was just an ever-changing world. The Cabrini administration was extremely supportive. And I would go a step farther and say not only the Cabrini administration, but also the community as a whole. We had everyone coming out to donate food, to donate supplies. People were making masks for the staff. People were making scrub hats for the staff. Everyone really showed up and lended their support.
I was on the med-surg unit for 5 years, so after being there, I had the offer to go and move over to the COVID unit, and I really had to pray about it a lot. And I cried about it, I prayed about it. And then actually I read something that said to get out of your comfort zone. So that kind of like led the way, and I knew I had to just do it and put my fears aside. And I picked here because of the mission statement, because I am Catholic and I pray all the time. So I definitely, this is the place for me to be.
The first day it was just what do they need? What can I do to help? Familiarizing myself. Usually I go out to all my units, I meet my nurses, I do, but you couldn't. I mean, those kind of interactions were not what we could do at the time. And of course, everybody wearing masks and trying to stay 6 feet apart, and nobody knew where was this all gonna go. So for me, that was the biggest challenge. But in that first month, I would say it was a challenge just to say, how do we make sure that whatever fires we put out today don't flare back up tomorrow? I could not have asked for a better place and a better team that we're all focused on, again, what is the best thing for the staff here and the patients that are here.
The off-site testing facility was a major undertaking. I was asked to put something together, and the goal was to offer the access to testing, but to be sure that the emergency departments were not overwhelmed with people wanting to be tested. So I knew real quick that that was going to be a major undertaking. So I brought together about 8 or 9 different entities here, local entities, to make this happen. The Department of Transportation, the National Guard, the Office of Public Health, 3 healthcare entities. And we brought all these people together with one goal in mind, and that was to offer mass testing to central Louisiana and make it very smooth.
Immediately, supplies disappeared. You could not hardly get them. And things we were used to getting in every day, no, we could not get. And we were very limited. Our proudest accomplishment is seeing that the frontline workers had what they needed. They've worked every day, not complained, even though the workload has increased, but they've not complained. They've just adapted and moved on.
We take care of the sickest of the sick. That sickest of the sick got worse. The patients were sicker, and the unfortunate thing was we did every case presented differently. But with COVID, having to get into a room, it's a different level of just running into a normal patient's room as opposed to getting into a patient's room who's in distress with their COVID. With this, since the pandemic started, I mean, there's even even more minute things you have to pay attention to. And as an ICU nurse, you're supposed to be the best of the best. Well, I feel like we've become a little bit more than the best of the best, because we have to be on, a top tier level to take care of these patients.
The people who were here are gonna say that was our finest hour. And I believe that not because we were better than anybody else in responding. I do think we've responded well. But I think they're gonna look back and say, I really was the mission. I really tried to be, in time of the greatest need of an unprecedented pandemic, I tried to be as compassionate as I could. I tried to give everybody the dignity that they deserved, and I tried to emulate the Christ-like characters that we're supposed to every day.